Emergency first aid and CPR. First aid. Basic step. When first recognizing an emergency, there are 5 basic steps to perform before CPR. Appraise the scene. Check the area for any hazards and safety. Responsiveness. Check consciousness. Tap victim on the shoulder and ask if they're okay. Alert. Gather extra people and delegate tasks. Breathing and pause. Check both at the same time within 10 seconds. Emergency Medical Service EMS. Call 911. Retrieve an AED. Unresponsive victims. When checking an unresponsive victims, there are 3 main ways to act depending on their pulse and breathing. Pulse and normal breathing. Monitoring person. Wait for emergency responders to arrive. Pulse, abnormal breathing. Maintain open airway. Rescue breathing. Trial 1 breath per second, 3 seconds. Although 1 breath per 5 seconds. No pulse and abnormal breathing, CPR. No pulse and no breathing, CPR. CPR. CPR stands for cardiopulmonary resuscitation. It is performed by repeated cycles of compressions, airway and breathing. Compressions, 30 chest compressions, 100 to 120 compressions per minute. Use 2 hands, places at lower half sternum between the nipples. Keep arms straight, hands interlocked. Compress 2 into chest. Allow the chest to fully recoil between compressions. Victim facing up on firm surface while person is kneeling beside them. Airway. Head till chin lift. During each breath, bring chin up using 2 fingers on the chin. If there's trauma, use jaw thrust. Breathing 2 breaths, each 1 second long. Blow until you see the chest rise. AED. During the process of CPR, the AED should be set up, stopped, and abnormally beating heart. Place pads on clean, dry skin on upper right and left chest. Adult pads for people aged 8+ years. Use smaller pads if younger. If rescuer witnesses the cardiac arrest on the scene of emergency, then use AED on arrival. If cardiac arrest was unwitnesses, then use AED after 5 cycles per 2 minutes of CPR. Shocking public domain. First start to encourage coughing. If victim is conscious and cannot cough, rescue use abdominal thrust. Use Heimlich maneuver. Rescue facing the victim back, placing arms around the victim with fists thrusting upward between the xiphoid process and navel. Infants, 5 back slaps and 5 chest thrusts. If victim is unconscious, CPR and check mouth before delivery. Press Heimlich maneuver. The brain can survive 6 minutes without oxygen.